Hello everyone, and thank you so much for joining me. I'm going to talk about something that actually affected my life a few years ago, and that something generally causes a fever, a headache, fatigue, and even that notorious bullseye rash. And it's called Lyme disease and Lyme co-infection. So first of all, that encompasses a host of diseases that are tick-borne illnesses that can cause major symptoms, kind of like having a nasty case of the flu in the beginning for a lot of people. But what I want to bring to your attention tonight is that many a times it does not have this abrupt kind of fireworks onset where you're bedridden, feverish, have a rash, have a headache, feel very lethargic, and those are the classic symptoms of an acute infection, in this case, Lyme we're talking about. So what about the many people who struggle with thyroid conditions and therefore have fatigue and weight gain and dry skin? What about the many of folks who have brain fog and you try a certain diet, maybe a ketogenic diet, or you do something like go gluten-free and corn-free and wheat-free and dairy-free, and all those are wonderful ideas, but you still have brain fog. What about all the people out there that have debilitating muscle aches and pains? So you do sensible things. You get a massage, you see your chiropractor, you have acupuncture, you get yoga, you join a gym, but you're still having extreme muscle inflammation and muscle pain. And you're looking back and you're trying to trace the hands of time, but nothing really seems to jump out. Well, jumping out is kind of what ticks can do. When I had my case of Lyme disease years ago, I happened to be on a Christmas tree farm with my family, walking through, doing that famous Christmas expedition up the hills and down and finding that perfect Christmas tree, having the joy of cutting it down and dragging it to the car and having some cocoa and coming home. A couple of days later, I was one of the fortunate ones. I actually found the tick. It was embedded in me. I did have the erythematous rash, and that EM rash that I had was my first intro into Lyme personally. So previous to that, I'd been treating many adults with chronic Lyme disease. So that again can look like fatigue and brain fog, joint pain, and other people can have it inside their tummy, right? Like irritable bowel syndrome problems, leaky gut, bloating, gas, constipation, diarrhea. Other folks, Lyme can attack the heart in a same kind of a manner that streptococcal can do, where that bug that you might normally think with strep throat can attack your throat or your joints or your heart in that case. But in this instance with Lyme disease, and many people, they never know they have it. And we're going to branch into now something called the co-infections. When I mentioned before low thyroid, there's something called Bartonella, okay? And it's another bacterium that lives within the bodies and the blood of these ticks, and it loves to jump aboard when you're bit. And it can attack the thyroid. You might have paresthesias, numbness and tingling. A common symptom is foot pain. Another one's brain fog. And another type of co-infection along with Lyme is something called Babesia, and it's a parasite. So you think, wait a minute, I didn't have raw sushi, I cooked my meat thoroughly, why would I have a parasite? Well, we know, unfortunately, even after all the stool tests that I've done over the years, I've done comprehensive stool analysis, we do it ×3, which means you take 3 different samples for parasites, and many people go, great, I don't have parasites, but they're still sick. They're bloated, they've tried coffee enemas, they've done detox, liver flushes, colon flushes, they've changed their diet, they eat high fiber, tons of water, and all of these are great ideas. But what happens sometimes, we can detect this on blood work, where we run panels looking for Lyme titer with Western blot to reflex, and Babesia panels and Bartonella panels. But I'll tell you the trick here, and I'm sure you followers of Dr. Richard Horowitz would know this very well. It is a clinical diagnosis, right? If we use his guidelines, having 63 or more of the points on the questionnaire called the MSIDS questionnaire that has now been approved for a diagnostic tool for Lyme, many people hit all those boxes. So they have the random migrating joint pains. They have the brain fog. You have the gut problems, kind of linking that to a parasite. You have major problems with brain fog, focus, concentration. So I can tell you as an adult having it, that is what happened to me. And I did a combination therapy. But unfortunately, and why I really want to get this message out tonight, treating Lyme naturally, is many people try antibiotics and are not successful, or at least put a pretty heavy dent in it, and it is helpful. And especially for those people, I think we could say, if you, like me, and you've seen the tick and you have the classic EM rash, I would say, and I think many other people would agree, you go ahead and treat up front with antibiotics, but do things on the back end. So my message tonight is for those people who, like myself, used antibiotics but could not get ahead of the game and back to normal health. What do? There's herbal protocols you do. But before we do that, we look at the constitution of someone's overall health. How's their immune system, right? Are they living in mold? These things called mycotoxins, the things we breathe in that might be in your basement or your home or your bathroom or behind a leaky wall where you had water infiltration and water intrusion into buildings maybe where you work or you play or you do recreation, right? And libraries and courthouses and gyms and schools too. Schools are notorious for having lots of mold. So it's this bucket load that burdens your immune system. And what if you have chronic mycoplasma pneumoniae, another bacterium that can wreak havoc on your immune system? What about you people who don't sleep well? Geez, I don't think I've ever talked to too many people who had issues with sleep, right? Oh my word, it happens every day in clinical practice. Folks have tried melatonin, they've tried theanine, you try GABA, you do all kind of things. You shut down your Wi-Fi at night, you shut off your phones, you're getting good rest in a dark, cool room, right? With the room temperature low, but you're not sleeping. Infections can be a big culprit behind why you don't sleep in this Lyme co-infection family. So unfortunately, again, for many people suffering, they have these different bugs in their body called co-infections. And on top of that, we know in this country, many adults are walking with chronic Epstein-Barr, cytomegalovirus, and other type of viral burdens that pull their system down. So if you don't sleep well, if you have viruses, history of other bacteria infections, you're carrying Lyme co-infection, unfortunately, it can be a major burden to your immune system in getting well. So we look at their constitution. We also look at their gut health, right? We know about 70% of the immune system is in the gut. So it is so important to turn our attention to a Lyme-appropriate diet, and we offer that at the clinic. So we build the immune system, we help out the adrenals, we nurture that gut back to good health called the microbiome, things like probiotics and fermented vegetables, for those people who can handle that, of course. And then we go sort of on this attack phase. And there's herbal plans out there that we can do, right? It is so interesting that many people who fail antibiotic therapy, who fail antiparasitical drug therapy, end up going naturally. And we find now here at Innovative Family Wellness and Dr. Noah's Ark, where I specialize in working with children, many people respond fantastically well to the herbal protocols. So why don't you check us out? Join us on other webinars and Facebooks and YouTube Lives and learn more about how you can be proactive using herbal therapies for Lyme disease. That's something that helped me greatly, so I hope this was helpful for you, sort of thinking about this paradigm of what my symptoms could be. Could they be related to Lyme disease? Sort of how do we look for this? Remember what I said, it's usually not going to be found on blood work, usually not going to be found on a titer or an antibody, because your immune system could be too low and unable to fight. So we generally have to go in this route of the questionnaires, putting together symptoms, and then we go in and control the infections. But afterwards, there's something we call picking up the pieces of Lyme, and that's helping your body respond thereafter. So rebuilding your system, making sure your blood levels are normal of B12 and vitamin D and folic acid and so much more. So stay tuned for more. Looking forward to talking to you more about the herbal protocols and specific detail that we use to help children when treating Lyme disease and Lyme co-infections. Thanks again, everybody. Check us out. Share this if this was somewhat helpful. And stay tuned, as coming up soon, there'll be lots more about working with Lyme and co-infection naturally. All right, everybody. Thanks again. You take care. Yours in health, Dr. Noah.